Again, I am Rhea, the Director of Health and Fitness, and I'm going to be moderating the talk tonight. We are very fortunate to have Dr. Neil Craton presenting tonight. Sitting is the new smoking. So why do we sit to exercise? So quite excited to hear the information he has to share with us. Again, if you have a question or a comment, please use the chat box. And without further ado, I will, oh, there's a couple people sneaking in. I'll make sure everybody's in on time. I will pass it over to you, Dr. Craton, and I will mute myself and have a great talk.
Thanks very much, Rhea. You can hear me okay? Thumbs up if everybody can hear me. Okay, great. Yes. So yeah, I'm really thankful to have this opportunity to speak to you, and I hopefully we can just have some fun tonight. You know, it's been a long winter, particularly with COVID, and exercise has become an increasingly valuable commodity for many, many people, especially exercising outdoors. Gyms have been closed, and so we have less access to things that we typically use. This has been kind of a bugaboo for me for many years, this idea of why we exercise sitting down. And when this expression, sitting is the new smoking, came to be, I thought, people are smoking at the gym. And that seems to be counterintuitive. So let's have a little fun tonight as we go through some of this. And I mostly want to make you people really good consumers of exercise. That's my main goal for you, that we become really good consumers and we understand the principles of exercise quite carefully. I was saying to my wife last night, I said, you know, Kate, in your wildest dreams, did you ever think that I'd be giving a talk at Reh-Fit via Zoom during a pandemic? And she said, Neil, you're not in my wildest dreams. And I found that was really quite hard to deal with, quite sad. So I was teaching in medical school this week, and the students really seem like they're kids. It's incredible how young they seem. This is my 37th year of practice, and so I really feel like I'm getting old. But one of my students has taught me how to text. So I know how to text. I got LOL down, I got OMG, I got all these great abbreviations, BTW. Well, a friend of mine sent me a text this week. He's also in his 60s, and he said, you know, we got to be clear that we're getting old. He said, you know, back in the day, we had long hair, and now we're just longing for hair. You know, back when we were young, we were looking forward to going to a new hip joint, and now we just want to get a new hip joint. You know, back in the day, we were hoping to get a BMW, and now we're just hoping to have a BM. So I hope you're laughing out there. I can't hear you, but I always found those kind of fun. So we're going to go through some really simple parameters tonight, and these are going to be binary statements. Exercise is good. I think we all agree, especially if you're a client of the Reh-Fit Center, you'll agree that exercise is good. So Cristobal Mendez, a physician from about 700 years ago, stated the following: the greatest way of all to preserve or restore health without diverse peculiarities is to exercise well. I really love that statement. Let it sink in for a while. If we exercise well, we can restore our health. And what a beautiful statement, without diverse peculiarities. I think that means without side effects of surgery and injections and medications. Okay, I think we're probably convinced that exercise is a fabulous modality. So Mendez says we have to exercise well, and I think it's an open question whether some people exercise well. I think many people do not exercise well, and I want to explore some of the things that go into the world's best exercise program for all of you, especially during COVID. This is it. If you can do this, you are going to be in great shape. So it's a very tough program. That's not it. So exercise is good. And this is our expectation that if I do all these crunches, I'm going to have a six-pack. And here's the reality of really what happens after the exercise that we do. We kind of get this big belly and it's all muscular and it's actually not doing what it's supposed to. It's not helping our back. I'm getting neck pain. So I would tell you that sit-ups are a terrible exercise. They make no sense at all. You should never do sit-ups. Again, a binary statement. This dog does not like sit-ups. So this is a statement that no scientists ever make, because scientists know that science is iterative. And when I hear people talk about following the science, it kind of makes me crazy, because as a consumer of science, I realize there's so much for us to learn about everything. Here's some science for you, so bear with me. I treat a lot of patients with knee and hip arthritis, and so I try to follow the literature on what's supposed to be done for them. Listen to this quote and tell me if you feel confident following the science. So this is from a systematic review of all the literature. 23 guidelines have been developed for the treatment of hip and knee arthritis. Although this suggests that a core series of recommendations for treatments exist, critical appraisal shows that the overall quality of existing guidelines is suboptimal, and consensus recommendations are not always supported by the best available evidence. This review of existing guidelines provides support for the development of new guidelines, cognizant of the limitations in existing guidelines. So if you're like me, you think, gracious, like, does this really help? Am I going to follow the science and therefore be able to help my patients? It kind of comes back to something like this. Hey, dude, when I said curls, I was thinking about something different. I really quite like that. So exercise, we can be giving false information if we come to the gym with curls on our mind. So as you're aware, there are several levels of evidence, and so-called systematic reviews where researchers look at all the evidence and try to compile the evidence is the top of the food chain. And then a randomized trial where you have people doing placebo tasks and they're followed prospectively into the future. That's the best type of evidence. And then cohort studies that kind of compare two groups, but not necessarily at the same time. And then we get down to editorials and expert opinions. At the very bottom of the list, we have a talk by Neil Craton, the worst type of evidence. And so that's what you're getting tonight, just to give you a heads up. Okay, you're still being patient with me. I haven't seen anybody drop out yet. We still have 40 participants. And okay, Doc, get to the point. How do I exercise well? That's what I want to know. Well, I'm just going to tell you, I'm going to make all this stuff up. Hope you're prepared for that. This is a systematic review, the top of the food chain, and it looks at shoulder rehab. Okay, I've got shoulder issues. What should I do? So 6 randomized controlled trials. Here's the conclusion. There is insufficient evidence to support or refute the effectiveness of specific resistive exercises in the rehabilitation of rotator cuff impingement syndrome. So there is insufficient evidence for me to recommend anything to you. So for shoulder problems, how do I exercise well? I have to make it up. How about back problems, Doc? There's got to be some evidence for back problems. Systematic review, Cochrane database, the top of the evidence food chain, motor control exercises for chronic non-specific back pain. What's the best? Well, there's very low to moderate quality evidence that lumbar stability exercise has a clinically important effect. We all tell people to do stability exercises for the core. Similar evidence for stability exercise with general exercise fitness and manual therapy. The choice of exercise for low back pain should probably depend on the patient or the therapist and their preferences. What you like to do, make it up. How about this paper? Does core stability exercise improve lumbopelvic stability through endurance tests more than general exercise in chronic low back pain? And this conclusion was that core stability exercises are not more effective than general exercise for improving low back pain. Just keep doing what you want to do. Stay active, stay fit. Now, I don't believe this. I believe there are specific benefits. I'm going to try to articulate them for you tonight, but they are not evidence-based. So what you're hearing is my opinion, and hopefully I'll give you some justification for it because the evidence does not exist. It's a real conundrum in the practice of medicine. And here's your reaction. Doc, like, get on with it. You're clueless. You don't know a thing about this stuff. Okay, let's go to some basics. Exercise. Regular, moderate aerobic exercise has few, if any, parallels for its contribution to health and well-being. There's a question about resistance training. We're going to answer that tonight. Intense exercise has little or no comparable benefit to moderate exercise. Moderate exercise is where it's at. Exercise is still vastly underutilized in the community, in their general population in Canada and in North America. Exercise probably has the greatest risk-benefit ratio and cost-benefit ratio of any health intervention. So exercise is fabulous. We're still looking for what we should do, but the general concept of aerobic exercise, not much is better. Who needs this product? Well, everybody does. It can reduce the incidence and prevalence and severity of many chronic disease states. So coronary artery disease, high blood pressure, diabetes, osteoporosis, certain cancers, back pain, obesity, high blood cholesterol, depression, fibromyalgia. Wow, that's a lot of stuff. It can extend your lifespan by a few years. Here's the key thing. It can increase your independent life expectancy, where you can live without assistance. It contributes to mental health and person's health benefits. So exercise is one of the best products we can use. Here's a really important disclaimer. More is better, right? And the answer is definitely no. More exercise is not better. So health problems decrease as exercise frequency goes from sedentary to moderate exercise intensity. As we go past moderate exercise intensity, health problems start to recur, and they're primarily cardiac in nature, although there are multiple musculoskeletal problems from trying to do things too much. And this is often not known by people. People who exercise regularly have markedly lower rates and mean life expectancy that is 7 years longer than those who are inactive. So let's be active. But there is a safe upper dose limit that exists, above which adverse effects of exercise probably outweigh the benefits. Chronic, intense, sustained exercise can cause patchy myocardial fibrosis, particularly in the small chambers of your heart called the atria, along the interventricular septum, the right ventricle, creating a substrate for both atrial and ventricular dysrhythmias. And some of you are probably at the Reh-Fit Center because of those types of pathology. Chronic, excessive, sustained exercise can be associated with coronary artery calcification, pump failure, as well as big artery stiffening. Veteran endurance athletes, such as marathon runners, ultramarathon runners, professional cyclists have a 5-fold increase in the prevalence of atrial fibrillation. And this study is really jarring. There's a 3 to 10-fold increase in atrial fibrillation amongst extreme exercisers. So there's a high level of significant cardiac deficiencies with too much aerobic exercise. There is a limit. So we want to be sensible, moderate aerobic exercise, about 30 minutes 5 times a week. That's all we need. 30 minutes 5 times a week. You can do more than that. And the question is, what is the place of resistance exercise? What's moderate aerobic exercise? Kind of fast walking is moderate aerobic exercise, where it's a little bit sweaty, a little bit hard to carry on a conversation, but it's not running as fast as you can doing high intensity interval training. So maybe I'll introduce you to a concept tonight, this concept of sarcopenia. So osteoporosis is weak bones, and sarcopenia is muscle atrophy and the loss of muscle, particularly with aging. And it is a major enemy which requires us to do strength training. So sarcopenia, a decrease in muscle mass, is a major modifiable health risk factor of aging, and it contributes to multiple morbidities. It may be the single greatest thing you can do to decrease all-cause mortality. It may be more beneficial than aerobic training. So we need to fight sarcopenia, and a simple statement is lift something heavy every day. And this will be different for everybody. It might be 5 pounds for you. It might be 50 pounds for you. But lift something heavy every day. I'll show you some things to do about that later on in the talk. So exercising well, what Cristobal Mendez said, helps to prevent sarcopenia. We fight muscle weakness and wasting. It's a major correlate of aging, and it's associated with a lot of bad outcomes, especially falls, fractures, frailty, and all-cause mortality. Falls amongst older adults are deadly. 1 in 4 adults fall each year over the age of 65. In the US, $50 billion is responsible from falls, huge Medicare expenses, and it's a preventable illness. Again, the true cost of falls, the average cost per fall, $14,000 in the US. These are staggering numbers. 1 million visits to hospitals annually in the US because of falls. You all know people who have died because of a fall. What are the risk factors for falls? Balance and gait deficits, so balance for sure, and decreased strength. These are modifiable. The environment is modifiable. Funky carpet, something too close to your bathroom, drugs may be required, cardiovascular medical problems, but these are the ones that are major modifiable just by our talk tonight, exercising well. And so there are screening questions for sarcopenia, commenting on how much you can lift, how can you walk, how you can get out of a chair, can you climb stairs, have you had a fall? I can make this available to you for your own scoring. Sarcopenia can be prevented. It's a preventable illness. How do you prevent it? By doing whole body resistance training. That's exercising well. So we're going to, a key component for the rest of our talk, whole body. And how much? Close to 80% of your 1 repetition max in this study to get the maximal strength gains, to prevent sarcopenia, to prevent falls, to help you with your balance, to maximize your life by minimizing all-cause mortality. In the context of the Reh-Fit Center, it's also okay. For review guidelines for cardiac rehab, 2016 paper from European Journal of Preventive Cardiology, that high-intensity aerobic programs should be supplemented by resistance training in cardiac rehab patients. So when we exercise well, we can do some aerobic work, and we do some whole body resistance strength work that prevents falls. Let's do that one more time. When we exercise well, we do whole body work, aerobic work that leads to resistance and strength training that would prevent falls. That's critical. So we get the picture. I need to do some strength work. Is this what it looks like? How do I do the strength work? This woman really impresses me. This brings us back to our title. Doc, I thought you were never going to get there. So sitting is the new smoking. Why would I sit to exercise? How do you think this guy's balance is being stimulated right now? Well, not at all. So how do I exercise without sitting, without smoking? Sitting is the new smoking, right? Sitting's not good for you. We see patients who sit regularly, 38% of them have regular shoulder difficulty, 63% have low back difficulty, half of them have neck difficulty, 33% have wrist difficulty. So sitting at your desk is great for my business. It's not good for your body. Sitting is not great. Why would you do it in the gym? How about for Reh-Fit clients? If you sit more than 4 hours in a day, you increase your risk of adverse cardiovascular disease by 125%, 50% all-cause mortality risk. So why would you ever do it in the gym? Why would you ever do it in the gym? So this guy's really handsome, but really stupid. This is a bad exercise, right? This is really irritating his knee joint. He's being seated. Nothing functional about this. This guy is smoking. Now, I love these ladies, but they're doing work in a seated position for their shoulders in a funky, I think they're smoking. Overhead work in a seated position, no balance recruitment, nothing for the gluteals, nothing for the quads. I think this person's smoking. Brief disclaimer on sitting. So there are some good things about sitting. Some people have to sit for work. If you sit regularly, do Brugger exercises to help maintain your posture, get to the edge of your chair, fire your gluteal muscles, retract your scapulae. Obviously, this would be a much better scenario on a treadmill, standing office, perfect ergonomics. Some people have to stand for work. This is an interesting trial that in people with arthritis of the knee, they will do better with this type of exercise than they will in a standing position. So if you have hip or knee arthritis, maybe you don't do well standing. Maybe you do need to do cycling work or some type of more seated-based exercise. These people will have less pain when they do this kind of simple cycling-based seated work. So there are reasons to sit. We can't be stupid about this kind of game we're playing. And it's a mental exercise I want us to go through. So many gyms look like this: seated machines, seated machines, seated machines. Here's the Reh-Fit website, and I gotta say, this looks really good. Almost nothing for people just to sit. Now, bikes, that's different, right? Great for knee arthritis to work on a bike. Recumbent bikes, good. I'm not crazy about some of the rowing machines. We'll talk about that in a minute. But everybody's standing here, standing-based exercises. This is all good. And obviously the people walking around the track. So why would you smoke at the gym? Let's look at some of the things we're talking about, why you wouldn't. These are the principles of good training. So for good training, you have to regularly overload the system or else you won't get any stronger. I have to lift a little bit more today than yesterday. If I don't do any work, things will reverse quickly. I need a variety of exercises to make my body do the best. There are some training thresholds I need to be careful. I can't increase my load by more than 10% in a week. I need to warm up and cool down, and I need specificity. One of the key 6 principles of strength training is specificity. What is that? Well, the exercise I do prepares me for the exercise I do. I want to be prepared for independent life, high function, navigating complex environments with all activities of daily living and common daily requirements. And I really want to prevent falls if I'm doing any exercise and I'm over 65. That's really important. How do you think this guy is preparing himself, right? This, not so good. Sitting increases the disc pressure in the back dramatically. So in a standing position, disc pressure here, 100%. In this position, very much like the position going into a rower, disc pressure goes up to 250%. It goes up 2.5 times just being standing. So sitting increases our disc pressure and often creates people having back problems. Muscle imbalances are a really key component of things I want to talk about. Another reason why we shouldn't sit. Sitting causes muscle imbalances. What do I mean by muscle imbalances? Well, you can see what's happening. The muscles at the front are getting short. The muscles at the back are getting long. Muscles at the front are getting short. The muscles at the back are getting long. Long muscles are weak. Short muscles are tight. Commonly seen. Do certain regular exercises cause certain postures? That's a reasonable question to ask. Does this exercise lead to this? This guy's smoking. He's creating a lot of negative neuromuscular memory here, really turning off his gluteals, really doing some irritation to his spine. Muscle imbalances causes from seated these tight hip flexors. Many patients complain of tightness at the front of their hip. Their buttock and gluteal muscles get weak. The upper back muscles become lengthened and weak from sitting. It causes shortening anteriorly and then lengthening of the back musculature. These patterns of muscle imbalance in the spine are called the crossed pelvis syndrome. This is the one I want you to really note. It causes inhibition and weakness of your gluteals, and weakness of the gluteal muscles is a very, very important functional deficit if you're having hip pain, back pain, or knee pain. So these patterns of muscle imbalance were first described by a Czech physiatrist by the name of Janda. And when you sit, the muscles at the front become shortened. So we get a short, tight hip flexor, for example. The muscle at the back becomes long, a long, weak hip extensor. That's what we get. So the gluteal muscle is long and weak, the hip flexor is short and tight. This is really common when you sit too much. Muscle imbalances are a major risk factor for back pain, shoulder pain, neck pain, hip pain, knee pain. Well, I don't want to perpetuate them in the gym. I want to eliminate them in the gym. Now, gluteus muscle strength is really important for many things like low back pain. And when you sit, you turn off the gluteal musculature. That's the last thing you want to do. So sitting creates negative consequences for the deep musculature of our lumbopelvic region. I'm just going to go through a series of slides and reflect on what sitting does to the best practices of exercise. So I'm going to go through each of these things for you. So I will say that sitting in a machine often are simple exercises, but if you're doing exercises, they should be relatively simple. They should integrate the whole body, but sitting doesn't do that. It really just activates one part. Like I'll do a knee extension exercise that just activates my quadricep muscle. When I do seated exercises, I'm usually not emphasizing something called co-contraction, where I turn muscles on both sides of the joint. I'm just turning on muscles, say at the front when I do a chest press. So I don't like that from that perspective. Good exercise emphasizes co-contraction, seated doesn't. Good exercise stresses balance, and obviously sitting inhibits balance training. This is one of the key things I want you to remember, because balance problems are a modifiable issue for falls, and falls kill thousands of people every year. Well, obviously, machines can't be used everywhere. You want to have an exercise you can do everywhere, anytime. If you can't go to the gym during COVID and the machine, it's no value to you. Exercises on seated postures often puts areas in harm's way. An overhead press really irritates my rotator cuff. Exercises in a seated position, like a knee extension, for example, often irritate arthritis and tendinopathy. We can do isometric, concentric, and eccentric training on machines. They're okay for that. Machines can do both open and closed chain exercises where one end of the joint is fixed, but exercises are posture damaging in a seated position. You want to do exercises that enhance your posture. Exercise in a seated position, machine-based, that is often not functional. I want to do things that are moving, balancing, encountering nature, encountering my home, the obstacles, not sitting in a machine. Again, I often just stress one joint with multiple machine-based exercises. And again, I'm often not doing core activation when I'm sitting. I'm in fact doing the opposite of core activation. So these are the principles of best exercise practice, and sitting contravenes almost all of them. So if you're like me, you like to go to the gym and watch what people are doing, and we say, why on earth would you be doing that? Let's go through a few. So for knee-based exercises, common sitting knee extension. He looks great, but this is really just working his quadriceps. His buttock is inactivated. He has a 90% flexion of his spine, which is increasing his disc pressure by about 100%. This is much more functional. All of the muscles of her body are working. She's getting balance by virtue of doing it on one leg. And wow, this one is a superstar. Bosu ball, lack of dynamic understanding here, really working her stabilizers, working the front chain by holding the ball. This works everything beautifully, one muscle. You get the picture. Now you're learning. The only good chair is one that you should get out of regularly. If you have to sit, let's do regular sit-ups, getting up from sitting, not a regular sit-up. Again, good strength-based exercises, even if you're a little old. The squat-based exercise, much more than a knee extension for your legs. There's something called dynamic valgus, where our knee bows in like this. We strengthen our hips to prevent it. It's important in back, hip, and knee problems, ACL tears. This is a completely silly exercise using these machines. Seated, gluteals are inactivated. You never do this in life. You always do this in life. Which one do you think is more representative of real function? Doing strengthening for the hip abductors with some bands, side to side, squeezing the adductor musculature while doing a ball squat. Much better whole body. Everything's working in these people. The preacher curl. Yes, the biceps look beautiful. Seated. This aggressive flexion, 250% increase in the disc pressure in his back. No balance load, no core load, terrible posture load. Beautiful exercise. Balance, core, gluteals are active, better posture, every muscle in the body working. 2 muscles. Now, these muscles are very important when you're going to the beach. Being seated, high disc pressure, poor posture going forward, trying to do scapular retraction, inhibiting balance, inhibiting gluteals, activating gluteals, great balance work, using every muscle in the body, better for breathing. Okay, I think you're getting the principles here, right? Being seated, overhead press, inhibiting gluteals, no balance load, no balance load, excellent balance load, same exercise, press, press. Take the machine away. Aggressive forward flexion, probably increasing her disc pressure by about 200% here. Terrible position, instability for the shoulder, bad for her neck, hyperflexion of the knee, bad for patellofemoral pain and arthritis. She's trying to help her shoulders. Here's a much better exercise for the shoulder. Stand on one leg. I think you're kind of getting these principles we're talking about right now. The pectoral muscles are usually short. Shortening them more doing the pec tech exercise is silly. Seated, inhibiting gluteals, you get the picture, no balance. Better for balance, more retraction, better for posture, terrible for posture. So these are the principles how you dissect your exercise program, assess it, look at it, evaluate it. How about back pain? Really epidemic in our culture, usually caused by forward bending. So a nice specific exercise. This is how people challenge their spine with some simple tubing, working quads, gluteals, back, guarding, flexion. So much better than other exercises we'll show you in a minute. Standing exercises for the spine. So often we go to the ground to do spinal exercise. Why? We hurt our backs when we're standing up. We certainly don't want to do things seated. I don't think you can get a more silly exercise for your spine than these types of kind of seated flexion exercises. Terrible for posture, activate the abdominal muscles, which inhibits the back muscles, inhibits the gluteal muscles, no balance. Compare that with the Palloff press. Great for balance, do it on one leg, erect, activating the whole core, much better exercise for the spine. I love the farmer's carry with kettlebells. This is how I lift something heavy every day. I have a 50-pound kettlebell and I carry it around the office everywhere I go. You can often just do this in one hand, and it's very good for the opposite side spine musculature. So if you're a frail elderly, this might be 5 pounds for you, right? One hand carry. But this is something about lifting something heavy every day. This is a great, great strengthening exercise. No machine, standing, balance, functional. So many of the beautiful principles. Well, doc, you told me I had tight hip flexors, so I'm going to stretch them. This is a passive stretch of the hip flexor. It makes sense. But this is an active stretch of the hip flexor by activating the gluteals. The gluteals get weak. This makes them stronger. It stretches the front of the hip. It's getting balance. If she lets go, she's really getting balance, strength, resistance, balance prevention. Better for all-cause mortality, decreasing the risk of falls. Wow, that's good stuff. So I can do a lot of work with these exercise bands, strengthening my hips. I'm stretching out the groin while strengthening my outer hip. So these beautiful functional exercises stretch the short part, strengthen the weak part at the same time. Good for balance, good for multiple functional requirements. There's our farmer's carry again because it's so good. So I'm going to wrap it up. So moderate aerobic exercise, probably nothing better for you. Between 30 and 50 minutes, basically every other day. You can do it every day. 150 minutes a week is our minimum. Regular resistance training, regular balance training, working as many muscles as possible when you exercise. Stop smoking at the Reh-Fit. So not sitting down when you exercise, unless I've got knee arthritis, doc. I've got hip arthritis, doc. I've got spinal stenosis, doc. Okay, maybe we're going to do things sitting down. If you don't, and if you're young, you should be doing things standing up. I have a website, neilcraton.com, with a lot of these principles articulated. And on YouTube, I have almost all my favorite exercises on some video for you to look at on YouTube. Just YouTube and then put in Neil Craton, and you'll see lots of different ideas for exercise. I'd like to stop and answer some questions and see if we have prompted any interesting thoughts.
We do. Thank you, Dr. Craton. We have one that just popped up. What about yoga and strengthening type of yoga? What's your thoughts on that?
If you are fit, yoga is an excellent exercise program. So many of the principles we've talked about, yoga meets perfectly. So balance training, probably nothing better than yoga for balance training. So many of the poses are really, really good for balance. Really, really good for strength, body weight strength, and really good for flexibility and multiple joint involvement. So yoga is really, really good for you, I think. Obviously, it's tougher now with classes being closed because of COVID, but there's home yoga. You need to be fit to do yoga. It's very demanding, even on the cardiovascular system. But I think there are multiple really good things. And sports medicine doctors are like gypsies. We steal from everybody. And we steal a lot from yoga practitioners about how to do rehab for multiple problems.
One question here is, I'm not sure if you're familiar with some of the equipment that we had at the Reh-Fit, but it was called a gravity machine or a total body trainer. So I'm not sure if you're familiar with that. Maybe you can't comment. We can leave that one if it's not familiar.
I'm not sure if I know that specific machine, no.
Okay, so we can answer your question later, Ms. Armstrong. There's one said one should alternate upper and lower body exercises.
Yeah, so I'm not really a proponent of that, actually, because what I do in my daily routine is my arms and my legs are working together. They are linked anatomically through what's called my thoracolumbar fascia. And I like to do things that work as many muscles as possible, upper and lower extremity at the same time. I think that that's really, really important to be doing. And so when people are doing bodybuilding, and you're trying to put on muscle mass, then often people will alternate so-called arm days and leg days and back days. But for most of us who are doing this to maintain functional integrity, to help prevent the travails of nature, to prevent falls, we can do these things, all the muscle groups, as many body parts as possible.
One person's just wondering how long, maybe like time-wise, should our resistance training be, and how many number of exercises you'd recommend?
So the recommendations are for fairly high resistance. We have what's called the 1 rep maximum. And for people to maintain their greatest strength, they like to do about 80% of what you can lift. So if I can lift 10 pounds with a bicep curl, they would recommend I train at about 8 pounds. So 80% of my maximum lift. And that would often be around 10 repetitions or when I feel I'm going to become tired from that exercise. But just doing something, again, when you're going to walk from the kitchen to the bathroom, why not carry a weight with you? And I do that around the house. I'm driving my wife crazy with my kettlebell. But I try to carry it everywhere because I want to lift something heavy every day. I don't want to get weak. That's a huge risk factor to all of us. Now, if you're frail, elderly, osteoporotic, we need to approach this with some degree of caution, particularly with forward bent exercises for the spine. But all people with cardiac problems, with spinal problems, with osteoporosis can do resistance training. If you're real frail, real elderly, talk to one of the folks at the Reh-Fit about a program. If you're not frail, you're not elderly, you can probably start this with a reasonable degree of safety. And I just do something like a farmer's carry, a fairly similar, simple exercise.
Great. Just something from the talks recommending to everybody. So if you see it in your chat box, just some a yoga that you can get on YouTube for beginners. So if you're thinking of starting a yoga, they're suggesting Sarah Beth Yoga. You can also just start with a Simply Stretch video that we have on our Reh-Fit Anywhere. There's kind of some yoga components to that. And then we have yoga sessions at Reh-Fit as well. So there's lots of options for everybody in this new world we live in. Everything's virtual. So ideally, if the Reh-Fit has it on their Reh-Fit Anywhere site, or you can find it probably on other channels to get an exercise video. If there's any other questions, you are encouraged to use the chat box on the bottom. I would have to say thank you very much for the presentation. It was great. I appreciated all your diagrams and breakdown of exercises, and I felt extremely guilty sitting the entire time you were doing the presentation, and I'm kind of itching to stand up now because I'm feeling like I should stand up and go grab something heavy and carry it around my house. Someone's asking, what about Tai Chi?
Yeah, I think so. I would always say let's become good consumers. And when you think of something like Tai Chi, it's weight bearing. So it's using kind of balance. It's multiple muscles. It's relatively complicated but elegant patterns of movement. So very good for what's called kinesthetic awareness, keeping my body in multiple places at the same time, helping me navigate my environment. So I think Tai Chi is a great example of use as many muscles at once, do something standing up, do something that's going to challenge your balance. You could get a little bit better in terms of doing some of the resisted training. So you might, on the way to Tai Chi, carry something heavy, like a farmer's carry on the way. And I'm really serious about that farmer's carry. Start low and go slow, but you'll find that it's a great way to activate your shoulders, your core, your gluteals, and it's so functional. What's more functional than carrying around something heavy? Incredibly simple. So I think Tai Chi is a great exercise, and there's evidence to support Tai Chi for both back and shoulder problems.
I would have to agree. I grew up on a farm, and my dad could not understand why I was going into exercise. He just also thought I should just pick up something heavy and carry it, and that's what he did as well. And he remained very active till his 80s. So someone wanted to say thanks for the wonderful presentation. It was humorous, and I can say, yes, our mics were muted, but I was laughing at home, and I think all of our participants were laughing. You had very good jokes. Someone talked about, I recently read about carrying a loaded backpack during walks. What's your thought on that?
Yeah, especially if it's loaded with beer. I mean, that's the best way to do it.
Yeah.
I think that increasing the load that you're bearing makes sense. Now, the backpack is very, very practical. Now, I will tell you that some people do feel spinal pain with weight upon their shoulders in that way. I would say the farmer's carry would be better physiologically than the use of a weighted backpack, but making your system bear load helps to keep it strong and fight off the evil sarcopenia. By using a backpack, you're virtually using all the muscles of your body, maybe with the exception of your arms, to bear more load. And so I think that would fit into kind of some of the principles. So is what I'm doing stressing many muscles at once? Is it making me do balance work? Is this functional and practical? Yes, walking is the most functional and practical activity we do. So making it a load-bearing activity, I think that's a really smart idea.
There's one question here, and I'm going to read between the lines. So maybe if I'm interpreting wrong, Shirley Ann, you can correct me. But you've mentioned a lot about the farmer carry. So that's kind of a point A to point B scenario. I'm not sure, maybe this individual is asking, do you suggest carrying weights kind of during your cardio? So going for, say, an extended walk and carrying weights with you, or would you not recommend that? I guess maybe that's what I'm asking through this question.
Yeah, I think that you could do both of those. Obviously, that's going to be a lighter weight. So this idea of lifting something heavy every day, there's something to this kind of 80% of your one repetition maximum, so fairly high resistance. So when I'm carrying, say, 5-pound dumbbells for a walk around the track, that's obviously more within my capacity. So that would be lifting something light. So we might do a both and, that I might carry some weights when I walk, and that's probably using more musculature that fits with our kind of some of our key premises. Load as many things as possible. And then I might just do something like the farmer's carry, and we probably maybe had too much emphasis on that, although it's just so simple, and it has many of the principles that we're looking for here. So maybe both. So I would carry a heavier weight for a short distance. We recommend the farmer's carry for a minute per side. So I usually do just the right arm, walk for a minute, and then the left arm, walk for a minute. So it might be something as simple as carry my weight to the bathroom in my right hand and carry it back to my desk in my left hand.
If we did wear a backpack that was loaded, would wearing it in the front be better than wearing it in the back? Would that change anything, or just
I think it would be both and. So I think that wearing it in the front would challenge what's called the anterior chain. So the anterior chain, your abdominal muscles are relied upon for spinal health. Spinal health is probably most influenced by your gluteals, and then your back extensors, and then your abdominals. For years, we approached it the other way around. Ab work, ab work, ab work. So wearing something on the front works your anterior chain, most of your abdominals well. So again, I would probably do it a little bit both ways. Maybe for half the walk at the front, half the walk at the back. You'll probably get more bang for your buck using it at the back. You'll get more gluteal load there and more for your back extensors, which probably have more evidence of being preventative and therapeutic for spinal and hip problems.
Sounds good. I think it's all about balance is what I'm really taking away, making sure that you use upper, lower, front, back, the whole component of your body when you're doing your exercise.
Right. Let's make every muscle work. And that's the real dig I have with so many machines. They isolate one muscle group.
Yeah.
And I think we're not entirely wasting our time, but we can have such a better investment. It's like I put my money in a GIC and I got 2% out of doing that seated knee extension, but I could be doing a one-legged Bosu ball squat and getting 50% of my money. Well,
yeah.
Who wants the better investment?
Yeah, exactly. I agree. So I'm going to, a few more comments, just thanking you. So I am going to take this opportunity to thank you again, and thank you to all the participants. I want to remind everybody that next week our talk is on a Wednesday, so we're changing things up, and it's going to be Garen McDonald, and he's going to be talking about heartbeats. So using beats per minute to exercise effectively. So we'll tune in for that. That's Wednesday, March 3rd, same time, 7 o'clock. And I will see everybody then. And I hope everybody has a great weekend. Thanks, everybody.
Thanks very much, Rhea.
Thanks. Bye.
Bye, everybody.
Bye.
Thank you. Bye, Jen and Mick.